Question 1. A term newborn delivered via emergency cesarean section for fetal distress is limp, apneic, and has a heart rate of 70 BPM at birth. The nurse initiates the neonatal resuscitation protocol, NRP. Which action should the nurse perform first? A. Begin chest compressions immediately. B. Provide positive pressure ventilation, PPV, with a bag mask device. C. Administer epinephrine via umbilical vein. D. Intubate the newborn immediately. Answer. B. Provide positive pressure ventilation, PPV, with a bag mask device. Rationale. A heart rate less than 100 BPM with apnea requires immediate ventilation. Effective ventilation is the priority before compressions or medications. Question 2. A newborn is noted to have central cyanosis, tachypnea, and grunting shortly after birth. Oxygen saturation remains at 82% despite oxygen therapy. The provider suspects persistent pulmonary hypertension of the newborn, PPHN. What is the priority nursing intervention? A. Initiate enteral feeding. B. Minimize environmental stimulation. C. Place the newborn in Trendelenburg position. D. Administer oral antibiotics. Answer. B. Minimize environmental stimulation. Rationale. Reducing stimulation prevents hypoxia and pulmonary vasoconstriction, which worsens PPHN. Question 3. A preterm newborn develops sudden respiratory distress, asymmetric chest movement, and decreased breath sounds on the right side. The nurse suspects pneumothorax. What is the immediate priority action? A. Obtain a chest X-ray. B. Increase oxygen flow rate. C. Prepare for needle thoracentesis. D. Position the infant on the affected side. Answer. C. Prepare for needle thoracentesis. Rationale. A tension pneumothorax is life-threatening. Immediate decompression is required before diagnostic confirmation. Question 4. A newborn with meconium-stained amniotic fluid is born non-vigorous, poor tone, heart rate 90 beats per minute, no respiratory effort. What is the nurse's priority action? A. Stimulate the newborn vigorously. B. Begin PPV immediately. C. Perform endotracheal suctioning. D. Delay intervention until spontaneous breathing begins. Answer. B. Begin PPV immediately. Rationale. Current NRP guidelines recommend initiating ventilation rather than routine intubation, suctioning. Question 5. A newborn develops hypoglycemia, blood glucose 30 mg DLEL, with jitteriness and lethargy. What is the priority nursing intervention? A. Feed the newborn breast milk immediately. B. Administer IV dextrose bolus. C. Place the newborn under a radiant warmer. D. Monitor glucose in 1 hour. Answer. B. Administer IV dextrose bolus. Rationale. Symptomatic hypoglycemia requires immediate IV glucose to prevent neurologic injury. Question 6. A newborn presents with a scaphoid abdomen, severe respiratory distress, and bowel sounds in the chest. The nurse suspects congenital diaphragmatic hernia. What action is contraindicated? A. Insert an orogastric tube. B. Intubate the newborn. C. Provide bag mask ventilation. D. Prepare for surgery. Answer. Provide bag mask ventilation. Rationale. Bag mask ventilation increases gastric distension and worsens lung compression. Question 7. A newborn becomes cyanotic during feeding and improves when crying. The nurse suspects choanal atresia. What is the priority intervention? A. Initiate oral feeding with thickened formula. B. Insert an oral airway. C. Position prone. D. Administer oxygen via nasal cannula. Answer: B. Insert an oral airway. Rationale: choanal atresia obstructs nasal airflow. An oral airway ensures patency. Question 8. A newborn develops bilious vomiting and abdominal distension within hours after birth. What condition should the nurse suspect? A. Pyloric stenosis. B. Intussusception. C. Duodenal atresia. D. Gastroesophageal reflux. Answer: C. Duodenal atresia. Rationale: bilious vomiting shortly after birth indicates intestinal obstruction distal to the ampulla. Question 9. A newborn has a heart rate of 50 BPM despite 30 seconds of effective ventilation. What is the next step? A. Continue ventilation only. B. Start chest compressions. C. Administer epinephrine immediately. D. Reassess in 1 minute. Answer: B. Start chest compressions. Rationale: HR less than 60 BPM after effective ventilation requires chest compressions. Question 10. A newborn with suspected sepsis presents with temperature instability, poor feeding, and apnea. What is the priority intervention? A. Start broad-spectrum IV antibiotics. B. Obtain blood cultures after antibiotics. C. Delay treatment until confirmation. D. Provide oral hydration. Rationale: neonatal sepsis is rapidly fatal. Antibiotics must be started immediately after cultures are drawn, not delayed. Question 11. A late preterm newborn develops apnea and bradycardia episodes 6 hours after birth. The nurse notes shallow respirations and oxygen saturation dropping to 78%. Which intervention is the priority? A. Initiate tactile stimulation and monitor. B. Administer caffeine citrate. C. Begin positive pressure ventilation, PPV. D. Obtain arterial blood gas. Answer: C. Begin positive pressure ventilation, PPV. Rationale: apnea with bradycardia and hypoxia requires immediate respiratory support. Ventilation takes priority over medications or diagnostics. Question 12. A newborn delivered after prolonged rupture of membranes develops respiratory distress and temperature instability. The nurse prepares for a sepsis workup. Which action is most important to perform first? A. Administer IV antibiotics. B. Obtain blood cultures. C. Start IV fluids. D. Place on continuous cardiac monitoring. Answer: B. Obtain blood cultures. Rationale: cultures must be obtained before antibiotics to identify the causative organism, provided it does not delay treatment. Question 13. A newborn receiving phototherapy for hyperbilirubinemia suddenly becomes lethargic, hypotonic, and develops a high-pitched cry. What complication should the nurse suspect? A. Hypoglycemia. B. Kernicterus. C. Sepsis. D. Dehydration. Answer: B. Kernicterus. Rationale: neurologic signs in a jaundiced newborn indicate bilirubin toxicity affecting the brain. Question 14. A newborn with hypoxic ischemic encephalopathy, HIE, is undergoing therapeutic hypothermia. Which assessment finding requires immediate intervention? A. Core temperature of 33.5 Celsius. B. Heart rate of 90 BPM. C. Oxygen saturation of 88%. D. Mild hypotonia. Answer: C. Oxygen saturation of 88%. Rationale. Hypoxia worsens brain injury. Maintaining adequate oxygenation is critical during cooling therapy. Question 15. A newborn presents with excessive oral secretions, choking and coughing during feeding attempts. The nurse suspects tracheoesophageal fistula, TEF. What is the priority nursing intervention? A. Attempt oral feeding slowly. B. Insert a nasogastric tube. C. Place the newborn in supine position. D. Position upright with continuous suction. Answer. D. Position upright with continuous suction. Rationale. Prevents aspiration by managing secretions and maintaining airway patency. Question 16. A newborn develops sudden pallor, hypotension, and tachycardia after birth. The nurse suspects acute blood loss. What is the priority intervention? A. Administer IV fluids or blood products. B. Monitor vital signs every 30 minutes. C. Obtain hemoglobin level. D. Keep the newborn warm. Answer. A. Administer IV fluids or blood products. Rationale. Rapid volume replacement is essential to prevent shock and organ failure. Question 17. A newborn born to a diabetic mother exhibits tremors, irritability, and a high-pitched cry. Blood glucose is 25 milligrams per deciliter. What is the priority action? A. Encourage breastfeeding. B. Administer IV dextrose. C. Swaddle the newborn. D. Monitor glucose every 2 hours. Answer. B. Administer IV dextrose. Rationale. Severe symptomatic hypoglycemia requires immediate IV glucose correction. Question 18. A newborn with respiratory distress syndrome, RDS, is receiving continuous positive airway pressure, CPAP. Which finding indicates worsening condition requiring escalation? Respiratory rate of 60 per minute. B. Mild nasal flaring. C. Increasing oxygen requirement. D. Occasional grunting. Answer. C. Increasing oxygen requirement. Rationale. Rising oxygen needs indicate worsening lung function and possible need for intubation. Question 19. A newborn develops abdominal distension, feeding intolerance, and bloody stools. The nurse suspects necrotizing enterocolitis, NEC. What is the priority intervention? A. Continue enteral feeding. B. Insert nasogastric tube and keep NPO. C. Place in prone position. D. Administer oral antibiotics. Answer. B. Insert nasogastric tube and keep NPO. Rationale. Resting the bowel and decompressing the stomach are critical initial steps in NEC management. Question 20. A newborn has persistent hypothermia despite warming measures. The nurse notes lethargy and poor feeding. What is the most concerning underlying cause? A. Environmental exposure. B. Neonatal sepsis. C. Hypoglycemia. D. Prematurity. Answer. B. Neonatal sepsis. Rationale. Persistent hypothermia is a key sign of sepsis in newborns and requires urgent evaluation. Question 21. A term newborn develops sudden apnea, hypotonia, and seizures 12 hours after birth. The mother had a history of prolonged labor and chorioamnionitis. Which intervention is the highest priority? Administer IV anticonvulsants. B. Initiate broad-spectrum IV antibiotics. C. Provide immediate airway support and oxygenation. D. Obtain lumbar puncture. Answer. C. Provide immediate airway support and oxygenation. Rationale. Airway, breathing, and circulation take priority. Seizures with apnea require stabilization before medications or diagnostics. Question 22. A newborn presents with severe jaundice within the first 12 hours of life. The nurse suspects hemolytic disease. Which intervention is most urgent? A. Start phototherapy. B. Prepare for exchange transfusion. C. Increase oral feeding. D. Monitor bilirubin levels. Answer: B. Prepare for exchange transfusion. Rationale: early severe jaundice indicates hemolysis and risk of kernicterus. Exchange transfusion may be required urgently. Question 23. A newborn with suspected intracranial hemorrhage exhibits bulging fontanelle, high-pitched cry, and seizures. What is the priority nursing action? A. Minimize handling and stimulation. B. Administer oral analgesics. C. Increase environmental lighting. D. Feed frequently. Answer: A. Minimize handling and stimulation. Rationale: reducing stimulation prevents increased intracranial pressure and worsening bleeding. Question 24. A newborn develops tachypnea, nasal flaring, and retractions shortly after birth. Pulse oximetry shows preductal saturation of 95% and postductal saturation of 82%. What condition should the nurse suspect? A. Respiratory distress syndrome. B. Persistent pulmonary hypertension of the newborn. C. Transient tachypnea of the newborn. D. Pneumonia. Answer: B. Persistent pulmonary hypertension of the newborn. Rationale: a significant preductal-postductal saturation difference indicates right-to-left shunting. Question 25. A newborn becomes lethargic and develops metabolic acidosis. The nurse notes poor perfusion and prolonged capillary refill. What is the priority intervention? A. Administer IV sodium bicarbonate. B. Initiate fluid resuscitation. C. Provide enteral nutrition. D. Monitor electrolytes. Answer: B. Initiate fluid resuscitation. Rationale: shock management requires restoring circulation before correcting acidosis. Question 26. A newborn develops seizures secondary to hypocalcemia. Which medication should the nurse anticipate administering? A. Magnesium sulfate. B. Calcium gluconate IV. C. Sodium bicarbonate. D. Potassium chloride. Answer: B. Calcium gluconate IV. Rationale: IV calcium is required to correct hypocalcemia causing seizures. Question 27. A newborn with suspected congenital heart disease becomes cyanotic during crying episodes. What is the priority nursing intervention? A. Place in knee-chest position. B. Administer oral fluids. C. Encourage crying. D. Lay supine. Answer: A. Place in knee-chest position. Rationale: this position increases systemic vascular resistance and improves oxygenation during cyanotic spells. Question 28. A newborn develops severe respiratory distress immediately after birth and requires intubation. Which finding suggests surfactant deficiency? Answer: B. Ground glass appearance on chest X-ray. Rationale: this is a hallmark finding of respiratory distress syndrome due to surfactant deficiency. Question 29. A newborn presents with hypotension, weak pulses, and metabolic acidosis. The nurse suspects septic shock. What is the priority intervention? A. Administer vasopressors. B. Start broad-spectrum antibiotics. C. Initiate aggressive fluid resuscitation. D. Monitor urine output. Answer C. Initiate aggressive fluid resuscitation. Rationale. Restoring circulation is the first step in shock management before vasopressors. Question 30. A newborn with polycythemia develops ruddy skin, hypoglycemia, and respiratory distress. What is the priority treatment? A. Increase feeding frequency. B. Partial exchange transfusion. C. Administer oxygen only. Answer. B. Partial exchange transfusion. Rationale. This reduces blood viscosity and improves perfusion. Question 31. A newborn develops sudden bradycardia and oxygen desaturation while receiving gavage feeding in the NICU. The nurse notes abdominal distension and residual feeding in the tube. What is the priority nursing action? A. Continue feeding at a slower rate. B. Stop the feeding immediately and assess airway and breathing. C. Reposition the newborn to prone position. D. Flush the feeding tube with saline. Answer B. Stop the feeding immediately and assess airway and breathing. Rationale. Bradycardia and desaturation during feeding indicate possible aspiration or intolerance. Feeding must be stopped immediately to prevent further compromise. Question 32. A newborn with hypoxic ischemic encephalopathy begins to have recurrent seizures despite initial treatment. A. Increase environmental stimulation. B. Administer additional anticonvulsant therapy as prescribed. C. Initiate enteral feeding. D. Reassess in 1 hour. Answer. B. Administer additional anticonvulsant therapy as prescribed. Rationale. Uncontrolled seizures worsen brain injury and must be promptly treated. Question 33. A newborn presents with petechiae, bleeding from venipuncture sites, and prolonged clotting times. The nurse suspects disseminated intravascular coagulation, DIC. What is the priority intervention? A. Administer vitamin K. B. Prepare for transfusion of blood products. C. Monitor vital signs. D. Apply pressure to bleeding sites only. Answer. B. Prepare for transfusion of blood products. Rationale. DIC requires replacement of clotting factors and platelets to control bleeding. Question 34. A newborn develops hyperthermia, irritability, and tachycardia while under a radiant warmer. What is the nurse's priority action? A. Increase the warmer temperature. B. Remove the newborn from the warmer and reassess temperature. C. Administer antipyretics. D. Initiate IV fluids. Answer. B. Remove the newborn from the warmer and reassess temperature. Rationale. Overheating is likely. Immediate removal prevents further complications. Question 35. A newborn with suspected meningitis exhibits bulge in fontanelle, seizures, and poor feeding. Which intervention is the priority? A. Administer IV antibiotics immediately. B. Delay treatment until lumbar puncture results. C. Encourage oral feeding. D. Provide minimal stimulation only. Answer. A. Administer IV antibiotics immediately. Rationale. Meningitis is life-threatening. Treatment must begin promptly. Question 36. A newborn with a central line suddenly develops respiratory distress and cyanosis. The nurse suspects an air embolism. What is the priority action? A. Place the newborn in left side lying Trendelenburg position. B. Remove the central line immediately. C. Administer oral oxygen. D. Flush the line with saline. Answer. A. Place the newborn in left side lying Trendelenburg position. Rationale. This position traps air in the right atrium and prevents it from entering pulmonary circulation. Question 37. A newborn develops sudden hypotension, bradycardia, and decreased urine output after surgery. What is the priority nursing action? A. Administer IV fluid bolus. B. Monitor urine output hourly. C. Obtain lab values. D. Provide comfort measures. Answer: A. Administer IV fluid bolus. Rationale: these are signs of shock. Immediate fluid resuscitation is required. Question 38. A newborn receiving oxygen therapy develops retinopathy of prematurity risk. Which nursing action is most appropriate? A. Maintain the highest oxygen concentration possible. B. Titrate oxygen to maintain target saturation levels. C. Discontinue oxygen abruptly. D. Cover the eyes continuously. Answer: B. Titrate oxygen to maintain target saturation levels. Rationale: avoiding hyperoxia reduces the risk of ROP. Question 39. A newborn develops severe abdominal distension, absent bowel sounds, and signs of perforation. What is the priority intervention? A. Continue feeding. B. Prepare for emergency surgery. C. Administer oral medications. D. Place in prone position. Answer: B. Prepare for emergency surgery. Rationale: bowel perforation is a surgical emergency requiring immediate intervention. Question 40. A newborn with suspected metabolic disorder presents with vomiting, lethargy, and seizures. What is the priority nursing action? A. Initiate protein-rich feeding. B. Stop feeding and start IV glucose. C. Monitor vital signs only. D. Delay intervention until diagnosis. Answer: B. Stop feeding and start IV glucose. Rationale: metabolic disorders can worsen with feeding. Glucose supports energy needs while preventing further metabolic crisis. Question 41. A newborn develops sudden apnea and desaturation while on continuous cardiorespiratory monitoring. The nurse notes no chest movement and a heart rate of 55 BPM. A. Stimulate the newborn gently. B. Initiate positive pressure ventilation (PPV). C. Begin chest compressions immediately. D. Administer epinephrine. Answer: B. Initiate positive pressure ventilation (PPV). Rationale: apnea with HR less than 100 requires immediate ventilation. Compressions are only started if HR remains less than 60 after effective PPV. Question 42. A newborn with severe dehydration presents with sunken fontanelle, poor skin turgor, and decreased urine output. What is the priority nursing intervention? A. Initiate oral rehydration therapy. B. Administer IV fluid bolus. C. Monitor daily weight. D. Encourage breastfeeding. Rationale: severe dehydration requires rapid IV fluid replacement to restore circulation. Question 43. A newborn develops sudden cyanosis and respiratory distress after a difficult delivery. Breath sounds are absent on the left side. What is the priority action? A. Administer oxygen via nasal cannula. B. Prepare for immediate needle decompression. C. Obtain chest X-ray. D. Position supine. Answer: B. Prepare for immediate needle decompression. Rationale: findings indicate tension pneumothorax, requiring emergent decompression. Question 44. A newborn begins to exhibit signs of opioid withdrawal, including high-pitched cry, tremors, and irritability. What is the priority intervention? A. Swaddle and minimize stimulation. B. Initiate pharmacologic therapy. C. Increase feeding frequency. D. Place under radiant warmer. Answer. A. Swaddle and minimize stimulation. Rationale. Non-pharmacologic interventions are first line for neonatal abstinence syndrome. Question 45. A newborn with suspected sepsis develops hypotension unresponsive to fluid resuscitation. What is the next priority intervention? A. Administer vasopressors. B. Increase IV fluids. C. Monitor vital signs. D. Delay treatment. Answer. A. Administer vasopressors. Rationale. Persistent hypotension after fluids indicates septic shock requiring vasopressor support. Question 46. A newborn presents with severe respiratory distress and a barrel-shaped chest. Imaging reveals hyperinflation of the lungs. What condition should the nurse suspect? A. Respiratory distress syndrome. B. Meconium aspiration syndrome. C. Pneumonia. D. Transient tachypnea of the newborn. Answer B. Meconium aspiration syndrome. Rationale. Air trapping and hyperinflation are classic findings in meconium aspiration. Question 47. A newborn develops persistent vomiting, dehydration, and metabolic alkalosis at 3 weeks of age. What condition should the nurse suspect? A. Duodenal atresia. B. Necrotizing enterocolitis. C. Pyloric stenosis. D. Gastroesophageal reflux. Answer. C. Pyloric stenosis. Rationale. Projectile vomiting and metabolic alkalosis are hallmark signs. Question 48. A newborn with hypothermia develops bradycardia and lethargy. What is the priority intervention? A. Rapid warming with hot water. B. Gradual rewarming using a radiant warmer. C. Administer cold IV fluids. D. Delay intervention. Answer. B. Gradual rewarming using a radiant warmer. Rationale. Rapid warming can cause complications. Controlled rewarming is safest. Question 49. A newborn develops sudden seizures due to hypoglycemia. What is the immediate priority action? A. Administer IV dextrose. B. Encourage feeding. C. Monitor glucose. D. Swaddle the newborn. Answer. A. Administer IV dextrose. Rationale. Severe hypoglycemia with seizures requires immediate correction. Question 50. A newborn with congenital heart disease becomes acutely cyanotic and unresponsive. What is the nurse's priority action? A. Administer oxygen and position knee-chest. B. Start feeding immediately. C. Monitor vital signs. D. Place supine. Answer. A. Administer oxygen and position knee-chest. Rationale. This intervention improves oxygenation during a hypercyanotic TET spell.
If you made it this far, you're not just studying. You're training your clinical judgment at a level most candidates never reach. Newborn emergencies are not about memorization. They're about recognizing patterns fast and acting even faster. That's exactly what the Nclex is testing. If these questions challenged you, that's a good sign. You're sharpening the decision-making skills that save lives. Keep pushing, stay consistent, and remember, the nurse who passes is the one who thinks under pressure, not the one who just reads notes. I'll see you in the next one.